Hi, I'm Dean McKnight, and welcome to Taking Back Our Neighborhoods, an outreach program of Operation Our Town. Today we've got a terrific show for you. You've probably seen the motto, keep it safe, keep it going. I think you might know what that means, but today we're going to explain it a little fuller with terrific people here we have. We're going to start with Greg Drew from Value Drug Company. We've had Greg on before, and I've asked him this time not to use any big words because he's so smart that I didn't know what he was saying until after the show. And beside him is Jackie Bernard, the Blair County District Attorney's Office. Jackie, thank you.
Thank you for having me.
Thank you, and Judy Rosser from Blair County Drugs for adding beauty to the show. This is going to be a great show, huh?
Yeah.
We got beauty and brains and me. Which should be fun. Let's start off. Maybe we start off with Judy. How serious is this drug problem in Blair County? I thought we were winning.
Well, I think that we're doing a lot of good things, so I don't like to put it in winning or losing. I think what we have done is really activated our community, which is so important. And I'm sure Jackie can add to some of this too. But what we are seeing, which is a little bit disturbing around the prescription drug abuse, which is really their opiate type medications, Vicodin, fentanyl, OxyContin, those types of medications that are given for justified reasons, for pain, to help relieve pain. What we're seeing is really over the last couple of years a real increase in the diversion of that type of good medication for good reasons into our communities. And they're coming through prescriptions from physicians. I'm not saying physicians are doing wrong things, but what we do have is we have in our community an opiate using population. What that means is we have people that are physically dependent on these medications, and when they can't get heroin, they will go to prescription drugs, or if the prescription drugs are more available and cheaper, they'll use those first and back up with heroin. So we are seeing this happening in the community right now. The opiate population is probably our primary drug of choice right now coming in our door, but they're coming in our door, so they are seeking help, so that's a good thing. And what we're seeing, along with is the community rallying around this. The different partners that have come to the table to say, let's start working on this issue. We need to be doing things. So I think it's not a matter of winning or losing, but people do need to be aware they can be part of the solution, and I hope that's what we talk about today, is some of the things that people in everyday life can do to help us with this issue. And everyone's always asking, what can I do? What is it that we can do at my home to help address this issue? And so we're going to give them some real good facts today. And I don't know if Jackie may have more information.
Yeah, tell us.
Well, I would echo what Judy has said. She is seeing these folks in the treatment realm where people are coming to Blair County Drug and Alcohol to be assessed for appropriate treatment for whatever addiction they may have, and she's identifying this opiate population as a concern. Law enforcement is seeing those same types of trends. We are having more crimes committed in the name of opiate addiction. For instance, something as simple as a retail theft can actually be grounded in a drug addiction, where you have people that are stealing in order to support their habit by either selling the item that they're stealing or not being able to spend the money that they normally would spend to buy that item because they're spending it on drugs. When we talk about diversion, we're actually talking about medicine that is legally prescribed, that is being used by an addict either because they've stolen it from someone who had the prescription correctly, or they are going and doing some doctor shopping, forging scripts. All of those things are illegal activities. And the types of crimes that surround opiate addiction are anything from drug dealing itself to retail theft to drug overdoses. We have seen an increase in drug overdoses as it relates to opiate-related drugs. A lot of folks will actually get a fentanyl patch and use a fentanyl patch and overdose on the fentanyl patch. So law enforcement has the same types of concerns that treatment has around those issues, and we're fortunate that this group, Operation Our Town, has brought the correct players all in communication to identify these trends so that we can all act concurrently to help avoid the consequences to our community. And I think that's where Mr. Drew comes in with the Pharmacy Roundtable and some of the solutions that have been identified by business professionals in the community just by seeing what's going on in their stores and also dealing with their own clientele and hearing concerns back from the consumers.
Jackie, thank you. Greg, this is a crazy story, but we're talking about the abuse of prescription drugs, okay? Several years ago, after I retired from the bank, I had trouble sleeping. I think I was afraid the auditors were going to come in and figure out how I lived all those years. But the fact is, I just had a little trouble sleeping. So I said to my physician, can you help me? Is there something to help me sleep? And I'm going to say this name. I hope I don't give anybody ideas, but he prescribed Ambien. And 3 or 4 days after I started to take it, I was sleeping like a baby. I never took another one. Now, several years goes by, and I have some stress things, and I'm not sleeping again, and I say to my family doctor, how about a prescription for Ambien? And he looks at me like I'm crazy and says, not a chance. And I thought, now what's wrong with Ambien? It's a really good... Then I hear the news that young people are using this drug to get a high. They take, I don't know how many, and it gives them a high. Is there anything sacred, Drew? I mean, Greg, is anything?
Yeah, it's an interesting dynamic, Dean. There are a lot of different channels. Both Judy and Jackie spoke to them. You know, pharmacists are considered the gatekeeper, right? We're the last step between medicine and the community, so we take our responsibility very seriously. The nice thing about the Pharmacy Roundtable that Operation Our Town sanctions is that we actually bring together the different parts of the community so that we have different perspectives. We have law enforcement perspective, we have the medical perspective, we have the treatment perspective, and the prevention perspective. What you described, unfortunately, is probably the single largest non-theft part of drug diversion, and that is in the home. So medications left available to others in the home is a prime source for diversion and ultimately for abuse. Keep in mind that it's a lot easier to walk into grandma's medicine chest and knock out a couple of OxyContin than it is to drive into a shady neighborhood, risk arrest to get street drugs. So we talked, and Jackie talks about it all the time. The better job the pharmacists do, the tougher it is on law enforcement. The more law enforcement does, the tougher it is on pharmacies, because there's a need in the community. Well, it's not a need, it's a desire on the part of folks abusing this to get medication any way they can. So what we do as pharmacists, and we'll talk about a couple of the methods today that we've developed in the roundtable, is to try to not only educate but actually play our role in preventing diversion, you know, whether it's from inappropriate prescribing, inappropriate medication taking, theft within the home, or giving. Let's just say it was working so well for you and your niece was having trouble sleeping and she was in for the weekend. You might not think anything about giving her one. Well, she might like that a lot, and then she might take 2 and 3, and the next thing you know, you've created a problem you didn't even intend to create. And I think the educational component is the toughest piece to get across.
So people, you know, if you're my age, and if that 29 isn't a bad age to be, I want you to know. If you're my age and you've got some drugs, which you probably do, this is what we're talking about, folks. We're part of the problem. We're not getting rid of these things. We're keeping them in our house. The grandkids come, oh, my little Susie, my Billy, he wouldn't hurt me. And the next thing you know, the drugs are missing. And you say, well, I guess I must have thrown that away. Because at 29, the memory isn't as good as it was at 28. And we're part of the problem, people my age. Greg, expound further on what's happening now to control this.
One of the landmark actually movements on a statewide level has been passage of a prescription drug monitoring legislation. And what that means is, for the first time, there will actually be a database available to pharmacists and physicians to monitor the prescribing and dispensing of controlled medications throughout the state of Pennsylvania. So pharmacists will report this on a very timely basis. It will be available. So if you were to walk into your family physician and they were not quite sure about the danger of Ambien, they could very quickly check your history to see if you've been going to other physicians to shop, as Judy talked about it, or if you've been shopping pharmacies and paying cash, which is the loophole in the pharmacy end of things, because there aren't insurance databases that have a tendency to catch those things. So this prescription monitoring bill, which we hope will be up and running by the end of the year, like anything else, it requires a lot of work to get contractors in place and pharmacists able to get the information into the database. But we've seen it be extremely successful in other states from an awareness perspective, and it really cuts down a lot on the shopping aspect of prescription drug diversion.
Jackie, will that have any impact on your office?
Oh, it's going to be real time, correct? Yep. These folks were at the groundwork level of making sure that that legislation was moving, and my understanding is that it will be real time access by law enforcement to see perhaps the doctor shopping, the fraudulent scripts, maybe over-prescribing by certain professionals will also be able to be monitored. So this is going to be a very useful law enforcement tactic, an investigative tool that they can use to identify those in the community who are abusing either their privileges under the law by prescribing or abusing the doctor network by asking for drugs inappropriately.
So when people are coming to you, they're coming to you for treatment, Judy.
That's
am I correct?
Mm-hmm.
And so I guess the traditional, I'm hooked on heroin is only one of the many aspects of these people coming, right?
Right. We have numerous drugs of choice coming in. We have kids using different kinds of things. We have adults that are coming in with alcohol and marijuana and others, but opiates clearly are some of the highest population coming through the door right now, mostly because with opiates there is such a physical dependency to that drug that when they don't have it, they do get sick. So they're very motivated to find their next use, and so they're seeking. So for them, the criminal aspect really does come into play because they do end up doing what they need to do to get that next use, whether it's being a street-level supplier, or whether they're stealing, or whether they're going into people's homes and diverting it out of the medicine cabinet. So there are different ways that they're going to go after that. But yeah, we are looking at those individuals coming in and seeking help.
Judy, I've heard this word a couple times. Opiate? What is?
Well, when we're talking opiates, we're talking a type of it's a type of drug, and probably Greg would be better to talk about as the pharmacist.
Well, go ahead.
But what the difference? But the heroin and the prescription drugs have this type of drug in it. But I'll let
opiates. We won't turn this into too much of an educational thing, but opiates, by definition, generally have a morphine-like base. Come from the poppy plant.
So that's a definition of a drug.
Well, definition of an
Type.
opiate-type drug, and an opiate comes from the word opium, which comes from poppy and is the root of all evil, and good medicine when it comes to opiate narcotics. And there are numerous. You've heard both Jackie and Judy talk about fentanyl and oxycodone, and those are synthetic derivatives of the original opium. And because of the addictive properties and the body's desire for more, because it's fairly easy to become physically addicted and emotionally addicted. Judy can speak too much better.
I must confess, I've never in my life been challenged to get some high. I mean, I always thought life itself was challenging enough without adding to it. And sometime I wish we could get somebody on here to tell me why they started. What caused them to need a thrill so much?
I actually worked with Judy. I teach a class at St. Francis University, and I actually worked with Judy to bring a recovering addict in to talk to my criminology students, and they were amazed at how much of a normal life this person had before she became addicted, and her addiction was to prescription medications, and she was enabled by family members because they didn't want her to get in trouble, so they were constantly covering up for her, and she really was in her early 30s before she could acknowledge that her life was spiraling out of control. Her kids were not where she wanted them to be in life, and not the role model she wanted to be for her kids, and not the life she wanted to lead. And she had this transformation at that point in her life, but it took a long time for her to get to the point of saying, I need to be different. And, you know, I think everybody has a different trigger, but for her it was access. She had access, and she liked the feeling that she got when she used it, and that was as simple as it was. For me, it's a pair of shoes. If I find the right pair of shoes, that's the only high I need. But, you know, for other people, it's a little bit more,
and that's the pharmacology of...
Thank you, ladies. We're going to be right back. I hate to interrupt them, but
That's okay.
We'll be right back, okay? Welcome back. Wow, that first segment went so fast. It's just interesting. I'm fascinated. And now we're joined by a special individual, Mark Lingafelt from the Hollidaysburg Police Department. And Mark, share with us your experience. You've heard our discussion. Join in.
Oh, thank you. Yes, I've been with Hollidaysburg for about 18 years now as a police officer, and I'm engaged in this activity by collecting the evidence or the medication that is dropped off through a program that Hollidaysburg, Altoona, and Tyrone participate in for the community to drop off any unused medication.
Any unused medication, is there a special way they have to bring them in, or tell me how they do that?
The program is designed to combat the prescription abuse problem in the area. So just anybody, whether you live in Hollidaysburg, Altoona, anywhere in Blair County that you live, you stop by one of the 3 locations, and there's a locked box that they can dispense their medication into, and it could be anything that they have except for liquids, syringes, and I think there's just a couple other things that they're not allowed to dispense, but there is signs saying what they can and can't dispense, and they just drop it in there and they leave. It's anonymous. They don't have to do anything.
Where are these lock boxes located?
One's in the Hollidaysburg Police Department, one's at the Altoona Police Department, and the other's at the Tyrone Police Department.
So that's pretty easy to remember.
Yes.
As long as you're getting arrested for drugs, you may as well just drop them off there.
Well,
and they can't use them against you, right?
Dean, so the idea is because they are actually, people are disposing of unused medication, they need to be in a secure place. So police departments are the hosts, and we're very happy that these 3 police departments geographically stepped up to host these boxes for the community. And I would also like to take an opportunity to thank their municipal governing bodies, because they also had to be invested in this program in order to permit the police departments to host these boxes. They all have different hours of operation, and Value Drug has been kind enough to supply posters acknowledging these locations throughout the community, as well as the hours of operation. But the point is, these boxes are secure, so somebody can't come in and actually walk away with the box and all of the drugs, and they are under police surveillance, and the police have certain procedures that they have to follow when they are removing medication from the collection boxes. And then we are responsible in the district attorney's office to make quarterly reports to our grant for the amounts that we have collected and the types that we have collected. So,
wow, great.
Yeah.
As long as we're talking to Officer Lingafelt, do I see some, it used to be no shirt, no shoes, no service. Now it's no hat, no gloves, no sunglasses, no T-shirts with bad names. Tell us about that, Craig.
That's actually a real good initiative that recently got underway between law enforcement and pharmacy. And I think, Dean, just to kind of take a little side note, the importance and I believe the success of what Operation Our Town does is bring together the private and public activities for a much more synergistic good than you would see any of us trying to do it alone. So between the Law Enforcement Roundtable and the Pharmacy Roundtable, we have now worked with law enforcement and pharmacy to increase law enforcement presence around and in pharmacies. And as you know, that's a very good deterrent. If someone's thinking about going in and robbing a pharmacy, they're going to think twice with a police cruiser in the parking lot or Mark standing at the prescription counter. So by increasing the availability, partially funded by Operation Our Town, and this is the Cops and Shops program, and we ask the pharmacies to put stickers on their windows that not only go to the what they should and shouldn't wear, because that's obviously a trigger for folks to notice that, but also having the cops in shops and around shops makes a big difference from a deterrence perspective, because one of the things we haven't talked about yet is when law enforcement does a great job and pharmacy does a great job, people are going to rob pharmacies because they can't get them through diversion mechanisms. So that's another very significant piece that we try to do. And in fact, another initiative out of the Pharmacy Roundtable was to actually establish a countywide fax blast system. So any pharmacy who either is presented with a forged prescription or an attempted robbery or an actual robbery, one phone call will allow that information to be disseminated to every pharmacy in the county.
Wow.
So people can be able to be on the lookout, be a little bit higher presence, work with their local law enforcement to make sure everybody's aware of what happened in another community.
Mark, I have another question. This may sound kind of crazy, but many people, as we get up in age, getting around isn't as easy as it used to be. Let's say I was at one of the towers or one of the older places, and I had medicine, but I wasn't driving, and I don't want to take the senior citizens by. If I called the police department and said, look, I got some medication here I'd like to dispose of, could an officer pick those up at my house? I know that's putting you on the spot, but I think that's like I said, everybody, the people that are on medication aren't driving like they used to.
I mean, that's a great question. I mean, I'm not going to say no, but it does put us in a tight situation that we're coming to make delivery or pickup or deliveries, however, for medication. It's kind of overstepping our role as a police officer.
Oh, sure.
Maybe something could be worked out. I mean, that would have to be up to each individual police department, how they would be willing to help you. But I can't really specifically say that's something we would do.
So if somebody had the drugs and they couldn't get rid of them, at least they should call the police department and say, how can I get help? What can I do with these?
Yeah, that would
very
make
worthwhile,
sense, right? Yes.
So I hope you're listening to that, folks. If you've got drugs and it's not easy for you, at least call the police department. Give them a chance to help you.
Exactly.
These are good guys out there. Good looking, handsome, smart. And apparently they're better drivers than I am because they don't get tickets. Judy, do you have anything to add to this?
Well, just everything that they're talking about here are prevention efforts to minimize this issue in our community. Our office did a local survey here last fall, and two of the local conditions that we saw and that we need to really stress is that outside of the people who work around this issue and know how bad this issue can get in our community, outside of that, people aren't too aware of it. And so what we had to do is really educate people, because like you were saying, if you have medications in your home, you're more at risk possibly for them being diverted out of your medicine cabinet. So one of the billboards that we put out right now is, who else is taking your medications? Lock them up. So it's really about controlling your medication, no different than if you were a young parent and had alcohol in your home and had young children in your home, you would keep control of that alcohol. You need to be keeping control of your medication, making sure they're locked up. And if you want information on how to get a lockbox, because they're just very small, very easily to maintain, but they're a good way to keep your medication secure so someone can't divert it. Because like you said, you would never think that little Susie would come in and take your meds. But little Susie, if she has an opiate issue and she is abusing opiates, little Susie will try to take your meds. So we need to make sure that, number one, that especially our senior citizens are safe and that they know to control their medications too, that they could be a target. The other thing is that parents aren't talking to their kids about this issue. That was the other local condition. that mom and dad aren't talking. They're talking about alcohol maybe, and they're talking about other drugs, illegal drugs, but they're not talking about sharing medications. Of like if John goes in and gets a sports injury and ends up getting surgery and has a prescription for pain medications, not to share those medications and to have control of those medications actually when that child is on them, and dispensing that medication to the child, not letting them have control of that medication is very important. But the parents need to be aware that that's one of our local they need to be talking, because this is a real issue, and once somebody's in an opiate addiction, it's a very difficult to treat, and it takes a lot of work to treat that addiction. So we really want to prevent it. And some of the things that they were talking about here are other ways to get the medications off the streets through the take-backs, which are so important. And then, of course, what Greg was saying about the partnership with the pharmacies, about limiting that exposure or diversion in our community. So those are really important pieces of how you address this issue.
So, Dean, one of the things that Mark and I were talking about before we came this morning was that Cops and Shops, that program, which is what Greg was describing a minute ago, and the pharmacy collection boxes are two ways that police departments and the district attorney's office, law enforcement, can be proactive. You know, many times Mark is responding to a call. You know, many times Mark is going to help another officer in relation to a call that's been made. But these are programs where law enforcement can actually be proactive on deterring crime, preventing crime. And it's a good feeling, I think, for police departments to be able to step up and take that role as well as being responsive, because we all want them to respond when we make a call, but this is an example of they're doing extra work in our community to make it safer, and it's not just a response call, it's something more than that. Law enforcement has had a great partnership with Operation Our Town from the beginning, but Operation Our Town is a good example of how bringing together treatment people and the business component from the pharmacies can help us all identify issues and then say, okay, what can we all do? And these two programs are the epitome of a collaborative effort, Cops and Shops and the medication collection boxes.
Mm-hmm. Mark, I want to close this segment by saying thank you. Sometimes our law enforcement, I get upset when I see the news media, excuse me, news media, but I'm sorry. Sometimes the police are right, and I see you have your vest on today. Both my brothers were police officers, and I respected them and what they did, and that they risked their lives every day. And you're appreciated. People may not always say that, especially if you've pulled them over. but I'm telling you, you guys are doing a terrific job out there, and thank you from the entire community. And I want you to stay safe and keep up the good work.
Thank
You're
you.
a special individual.
Thank you.
We're going to be right back, folks. Thank you very much. I keep hearing about this thing, and I love the concept. And I think, I always felt I was part of the Neighborhood Watch program, even if it wasn't organized.
Sure.
I was just a nosy neighbor.
Sure.
But tell us about the program.
Well, Dean, the common theme through your first two segments were forming partnerships and working as partners. And that's really what the Neighborhood Watch program's all about. I've been a law enforcement officer in Blair County for more than 35 years, and I've always been one of the first people to admit that police and the other law enforcement officers cannot handle the crime in our communities without forming partnerships. And one of the best partnerships that we have is Operation Our Town. And we have joined forces with the Sheriff's Office, the District Attorney's Office, and the Altoona Police Department, along with Operation Our Town. And we're continuing the Neighborhood Watch program throughout Blair County. Now, the concept is not going out on patrol, not being a vigilante. It's simply 3 tenets. It's be aware of your surroundings, neighbor looking out for neighbor, and reporting suspicious activity to the local law enforcement agency. That's really what it's all about.
Wow. And Holly, how does, once it's reported, then what happens?
Once it's reported, obviously local law enforcement take their steps necessary to come to a good end of the situation, you know, to handle the situation.
Now, you guys usually get on, like, picking up warrants, people that have already been on their way to court, right? So you see the guys that are the baddest of the bad because they're already on their way to, you know, they're guilty of something. They just haven't admitted it yet. And you know, this watch program, maybe everybody doesn't appreciate what it means to keep those eyes. I remember when I lived in another city, a good friend of mine was an FBI agent, and we would talk about, you know, his job. And I always had this vision of guns blazing, Elliot Ness, I got a Tommy gun in the car. And I said to him, I said, how many disguises do you have? You know, do you have like mustaches and things you go out? He said, no. He said, I go to the bars at night and listen. I said, what? He said, I listen. He said, and information comes in, and then we pass that information around. And that's the importance of just being aware.
That's right. That's right.
You know, and you're absolutely right. Police officers, it's easier if you have some idea what you're getting into.
Well, as it was previously stated, so many times law enforcement is reactive, and this is an opportunity to be proactive. You said about being a nosy neighbor. That's exactly what we would like. We don't recommend that the neighbor intervene unless it's an absolute emergency, but neighbors know their neighborhoods far better than the police officers can judge what's going on in the neighborhood. The old days of having a neighborhood beat cop are over. They've been over for many, many years. Now we rely on the neighbors reporting activity that they know that's just not right. There's something that doesn't appear to be right in their neighborhood, and they should trust their instincts and give the police a call. I used to get comments about, well, I'm not sure what's going on and I don't want to bother the police. That's what we're here for. I would much rather respond to a situation and find out that it's innocent and a so-called false alarm than miss an opportunity to catch somebody in the commission of a crime.
Absolutely.
I'm sure Holly would agree with me on that.
Now, how would one get started in this thing, Holly?
The Neighborhood Watch program?
Yeah.
Attend to an Operation Our Town meeting. They occur monthly. And then just take the initiative to start one in your neighborhood. It's about getting your neighbors together and talking about you know, different situations, things that are going on, and taking the initiative is the big thing. You know, take that step to form the Neighborhood Watch.
So they would call the sheriff's department, and Mitch would answer, and he would say, "Is there going to be milk and cookies at the meeting?" If there's going to be milk and cookies, he would show up. Is that right?
Well, we have actually started a program. It's called Refuse to be a Victim, and Holly has really stepped up. Holly has become a certified instructor, and I'll let Holly describe what this program is all about.
The Refuse to be a Victim program was developed by the NRA in the mid-90s as a product for women to help them develop personal security, security in their households as well. And obviously, since then, it's expanded. The NRA felt that it would be beneficial to everybody, not just women in general. So I became a certified instructor last year. We are presenting our 4-part series starting the 31st March at the Divorce Center downtown Altoona, and our topic this time is going to be personal and home security.
Okay, stop right here.
Yes.
Let's say that really loud and over again. The first program, get a pencil, folks, because this is important stuff.
The first program is going to be March 31st, the Divorce Center, downtown Altoona, starting at 6 o'clock.
Okay, and the subject is?
Personal and home security.
Personal and home security. That's us, folks. That's us. We need to be secure.
Absolutely.
And thank you. And will the other programs after that?
Yes, there will be. It's a 4-part series. The whole Refuse to be a Victim program is a 4-hour training. So we needed to break it up into 4 different sessions.
Is there a cost to come to
It
that?
is, no, absolutely no cost. It's
free?
Yes.
And I'll bet they have milk and cookies.
I don't know about any milk and cookies, but but they will be getting some good information if they attend.
All of my friends from Weight Watchers will show up.
We definitely have to thank Operation Our Town, and in particular Shauna Hoover, the executive coordinator. Without their help, it would be impossible to present these very informative programs over the next 4 months.
Now, will there be any refreshments?
Not that I know, no.
Well, I'm going to tell you what. Before you leave here today, I'm going to give you $50 so that there's milk and cookies.
Okay.
So you hear that, folks? It's milk and cookie time. Be there. March 31st, the Divorce Center downtown.
That's correct.
Downtown. And that's wonderful. Mitch, is his program... I see advertisements occasionally where you're having meetings to teach people how to do this. Is it catching on?
Oh, it has over the years. I've been personally involved with Neighborhood Watch for more than 20 years. With my previous years with the Altoona Police Department, we would have individual neighborhood groups that would hold meetings periodically. We have moved on to a county-wide concept where we are gathering everybody from throughout the county, including law enforcement, the district attorney's office, and our office, along with other very interesting speakers that come in from time to time. We've had presentations from the district attorney's office, from the Attorney General's office, and now this Refuse to be a Victim program, which offers very common sense techniques on your own safety and safety around your home or during your travels.
Well, if you ever need a speaker, Jackie Bernard will come just to show you her new shoes.
Absolutely.
Just to show you her new shoes.
Well, Jackie has been very helpful, and along with the district attorney's office, they've been a good partner.
I guess basically it's awareness. Is that correct?
Yes.
Sometimes, like, I go out to get the paper in the morning, and I look around, I see a car parked at the corner. I know that's a bus stop for kids. Well, I recognize that car. If I didn't recognize that car, and there's a couple times when I haven't, I kind of hang around a minute till the bus comes, just to make sure that there's something happening there, right? And that's how easy it is, folks.
It is.
It's just being conscious. These kids are your neighbors. You love them with all your heart. You don't want to see anything happen to them. And even, every once in a while I hear about some older person who's living alone, and something happens that they fall or whatever, and gee, nobody found them for 2 or 3 days. That is so sad. Just be aware.
That goes back to the basics. Be aware of your surroundings, neighbor looking out for neighbor, and then reporting any suspicious activity to law enforcement.
I grew up down on 6th Avenue and 4th Street. Our houses were so close together, we were aware of every conversation in every house for the next 3 buildings. There were no secrets. You knew everything. But now the houses are further apart. I have to look through my telescope just to see what my neighbor's doing. And so I wish you a lot of luck. The program is wonderful. And Holly, it's such a pleasure meeting you. I can't believe we've never met before.
The pleasure is mine. I appreciate you having me today.
I've been arrested several times and taken to court. And I
I'm
guess,
sure we crossed paths then at some point.
I was afraid of that.
Holly's been a great partner with me in all of our operations at the Sheriff's Office.
Mitch, and I want to tell you, you're missed in the city of Altoona. You were a good officer.
Thank you.
You were a good officer.
Thank you. You're very
kind. And you're still a good man.
Thank you.
Like I said, I say to you what I said to Mark, underappreciated and overworked. Thank you for everything. Thank you for your efforts. We'll be right back, folks. Okay. Thank you. Welcome back. What a great show it's been, and what a great way to wind up. We're joined again by three of our special guests: Mark Lingafelt from the Hollidaysburg Police Department, Greg Drew from Value Drug Company, and Judy Rossiter from Blair County Drug Preventative Program.
Drug and Alcohol Partnerships.
Drug and Alcohol Partnership. We were talking about a subject, and we didn't get to pursue it, but you mentioned something about lock boxes, and Greg, you had tell us about that program.
Sure. I think it's important, Dean, for folks watching to understand that there's something that they can do today. So, Judy and I both spoke about the dangers of the availability of prescription drugs in the home. One of the ways that folks can help us prevent diversion is to purchase lock boxes, which are readily available. They can walk into their local pharmacy and ask them to get them one or order them one. They're typically $20 or $30, and they can make a really big difference in preventing diversion by friends and family.
They're that inexpensive.
They're that inexpensive.
I mean, the drugs cost more than that.
Well, that's right, and this isn't Fort Knox, but it's certainly going to deter what law enforcement would call an unintended crime, or a crime of opportunity, I guess.
Wow, that's really, folks, do your part. That law enforcement can only do so much. The pharmacists can only do so much. They're working hard, but we need some help. Mark, tell me about this Cops and Shops program. That's kind of a preventative program, isn't it?
Yes, it's preventative by us being visible. The goal is to deter any type of criminal activity from happening at a pharmacy.
That's really. I was in the banking business for many years, and we always attributed the fact that there weren't more bank robberies to the fact that we had such preventative measures. We had secret signals and radio waves and money that exploded and cameras everywhere. The preventative aspect was very important to us. And Greg, your guys have to feel a little safer. I mean, they're exposed.
They're out there on their own, and they're also having to deliver some very disappointing news to folks that are trying to obtain drugs inappropriately. So as they have to do their part to push away folks that have come in to try to get drugs through forgeries or through misappropriation of a physician's prescription, it's a tough position for them to be in. And it's very, very reassuring for them to know that there's law enforcement close by and helping to protect them.
I heard you mention earlier that the new Value Drug Company has taken extensive preventative measures just for those reasons that you say, hey, there's always some crazy person thinks they're smarter than you are, and they're really not. But like I said, most of the drugs, I don't know any drugstore that doesn't have cameras and things now. Isn't that correct?
That's pretty much the rule right now, for a lot of different reasons, but certainly for identification of folks that have been in the pharmacies to commit crimes.
So I just don't understand what could make a person so crazy that they know they're going to be on film. They know and I see these people a lot of times in their own neighborhood.
Well, I think Judy can probably speak to the desperation that's caused by abuse.
Well, tell us about that, Judy.
And that's dependency. I mean, that's the biochemistry that goes on in the brain. And especially with opiates, it's one of the, behind nicotine, it's one of the most physically dependent medications once you start building tolerance to it. It has its role. Don't get me wrong, pain medication has its role in treating disease and pain. But what happens is if someone's being, and a lot of times some of these individuals have started with a prescription. You've been given you had a surgery, you were given a prescription. There's no risk discussed with that patient of the potential for dependency on that medication. So they're taking them, needing a little bit more, and taking more because their tolerance. The brain actually develops receptor sites that accept that opiate, and when they don't have it, it starts putting off a chemical response which causes withdrawal, and they actually feel sick. And there's a lot of other reasons why dependency starts in individuals. There's some beliefs of the genetics factor that they're predisposition to the disease. So there's a lot of different reasons. But once that starts, once that's triggered and starts to happen, unless they have some really good supports in identifying that they have an issue, that disease will continue to progress. And that's where we see people starting to divert, trying to get more, going to different doctors. And we've been talking about doctors, and I want to make sure that we say, 90% of our doctors are there to do no harm and really are there to help and treat you and want to treat you well. But there are some doctors that, there are some that are misusing their position. Yeah. And that's a concern. So we need to really, the prescription drug monitoring program that Greg talked about earlier is one of those areas where that will help cut back that issue. That will definitely, it's an environmental strategy that goes across our whole state and will address that issue, because now where people could get a prescription from a doc up in northwestern PA and get it filled down in southwestern PA at a pharmacy, because that's where they need to go to get it filled because they've burned the bridges at other pharmacies. Now that won't happen because that system will talk across the state. We'll be able to see across the state what's happening. And so those are some of the strategies that have to be in place to help address, the dependency issue that we're seeing around opiates.
Greg, and there's other side effects to these medicines. I recently had a knee replaced, and the doctor was wonderful. The surgery was successful. A day and a half I was out of the hospital, and they gave me some pain pills. Okay. I took exactly what the prescription said, one every 4 hours. 2 days later, I was back in the hospital with kidney failure. I spent 8 days in the hospital with side effects from the pain medicine. And so there has to be some side effects to these kids that they don't even think about.
Yeah, that's without question. And it doesn't even speak to the issue of tolerance. So after you use that medication again and again and again, some of those side effects are not as apparent as they would have been at the beginning of therapy, which makes them all the more dangerous. Drowsiness and the inability to operate a vehicle are very significant parts of that.
So we've seen the coalition here that Operation Our Town brought about, bringing everybody together, and the communications. And I feel so good about that. I brag about Operation Our Town any chance I get, because I'm so proud of what our people were able to do. Our people created this. Our people administer it. Our people do the fund drive, and the impact in the community. I can't even imagine what this area would be like without Operation Our Town.
That was very well said, Dean. I know that when we first became associated with Operation Our Town, I was absolutely amazed after walking into my first 2 or 3 meetings to realize how much can be accomplished with the right people around the table. I probably never would have run into Judy or Jackie, right, or Mark. Yeah. Hopefully not Mark. But I think the ability for the public-private partnership for a common cause, and they do much more with law enforcement as well. But yeah, I certainly put a tribute to Mike Fiore and the rest of the board. It was mentioned a little early by Mitch, but we couldn't do any of this without Shauna Hoover, who brings us all together and makes sure we're there at 7:15 in the morning for our meetings.
That brings up an interesting point, Greg. Just the other day I was thinking about guests we've had on this show. And some of the most emotional guests were, we had one fellow that lost his daughter, and we had a young man who had beaten addiction and was working his way back. And I thought, you know, I wonder if there's anybody out there who has a story that they would like to tell, some compelling story. And so Shauna's probably going to kill me for this. Well, wait, there's police officers here, Shauna. Don't shoot yet. Why don't you call Operation Our Town? If you have a compelling story, why don't you call Shauna at Operation Our Town and maybe share with her a little bit of it, and perhaps there's an opportunity that we could get you to share with other people. Would that make some sense? Shauna? Are you shaking your head, Shauna? For you people that don't know Shauna, she is the talent behind all the administrative stuff, and works hard and gets very little credit, and so we kid her a little bit, but boy, she's a special person for Operation Our Town. You probably have dealt with her longer than anybody, Judy.
Yes, she has done a really good job with helping keep everything going, because it's hard when you've got that many different meetings that are going on to make sure that, you know, things are going out on time, that people, you got to keep them going, and that's, you know, what the Cigna is about. It's about, they've invested in this position, and Shauna's done a really good job at being able to make sure that things are out on time, that she keeps the meetings happening, that she keeps people pulled together to talk about the issue, and that's half of the work, is, you know, getting them to the table and making sure people are aware of when those meetings are.
What round tables do you sit on?
Right now, myself, I sit on the pharmacy roundtable and the steering committee, but staff of mine also sit on the faith-based roundtable, and I'm thinking that's it at this point. Pardon me? Oh yeah, the Northern Blair County also. We have staff on that one also.
Faith-based roundtable, that's a special group, isn't it?
Yes, it is.
Greg, how about you? What roundtables do you sit on?
I dedicate my time to the pharmacy roundtable, and am also a member of the steering committee.
That's wonderful.
For the collaboration. Yeah, Operation Our Town is providing a glue for the community to come together. And I know that in my busy day, or Judy's or Mark's, it would have been really hard for us to look one another up and try to accomplish things that we're able to knock out in a once monthly meeting. We put lots of initiatives underway.
Mark, you sit on any roundtables?
No, I haven't participated in any of them, but my participation with the prescription return, I think, has been so beneficial, and I just want to kind of stress that, you know, those boxes are out there for people to return their medications that they're not using, and when they do that, maybe they can think that they're helping fight crime in their community by returning the medication that they're not using. It's taking it out of the hands of anybody else that could get it, and in a way, they're fighting crime in their community, and it's not getting out there.
Folks, you know, I've said it before, and I'm going to say it again. It's going to sound like a plea for money, and it is. You can do your part. Doesn't have to be hundreds. $5, $10. Call up and volunteer. These people all are part of groups that need other people to help them get the job done. The Community Watch program that we heard from the sheriff. All these things are easily available and recognizable. I've got one more question I have to ask. I see names in the paper of people that are being prosecuted for drugs. And I used to see 19, 20-year-olds, 23-year-olds. Now I see 60-year-olds, 50-year-olds, 47. What does that mean? Are these people that were doing drugs at 20 that have now grown to an older age, or they surely didn't just start? Anybody help me with that?
I would say that's hard to say. I mean, it could be a little bit of everything. They could have been doing it their whole lives and then finally caught up to them, or maybe like they had a surgery and the addiction to the medication started with that, and then it just spiraled out of control for them. So I think there's a gamut of reasons why you're seeing older people get arrested for drugs. So I don't think there's one specific answer to that.
I think what you're seeing, Dean, and this is just purely speculation,
yeah,
but I believe what you're seeing is the folks of that age that are typically being arrested, or you see the the picture in the paper are probably more part of the distribution channel. Those are folks that have better access in physicians' offices because of injuries or pain or conditions. They're able to bring together like folks, and unfortunately that's a very big problem. We know that it all starts with the kids, and we've got to stop and we've got to communicate with those kids right from the get-go. But as we move through life, it becomes just as important to make sure that people are doing their part to prevent diversion.
Wow, that's, you know, like I said, now we've got this marijuana thing coming up. I see our legislatures talking about medical marijuana. Well, who doesn't? From what I see, anybody who has a blinking eye or a sneeze, it qualifies for medical marijuana. That's scary to me. Is that scary to you, Judy?
It's very. From a prevention standpoint, we're already seeing on our PACE data from last year when we surveyed over 2,100 kids in our schools that their perception, just because of the national movement, now, Pennsylvania hasn't done anything with this yet except talked about it, but because of the national movement and just about talking about it, their perception of risk of harm has gone down. And we know with kids, when the risk of harm of trying a substance goes down, use goes up. And that's very dangerous for our youth. We are putting our youth at risk. Our youth are already at risk. Marijuana is probably one of the drugs of #1 drugs of choice that they're using when we're treating kids. And it's very hard. People say, oh, it's not addictive. Well, it is. It changes the brain chemistry. That's what addiction is. It changes the brain chemistry. They may not have the physical addiction of opiates, but they do have a change in their brain chemistry. And when that changes, their desire to use continues. And what we see is with marijuana, kids starting with marijuana, they don't start with opiates first, typically not. Now, if they had a sports injury, that could be the one area, and that's a small percentage. Kids will progress on to other substances once they use marijuana. They're getting a high, and they will chase after that high.
And they need more and more to get higher and higher.
Well, and that's where they try experimenting with other substances, and opiates, when they experiment with that, is a very high risk of tolerance and dependency then.
The strongest proponent of marijuana that I personally knew anything about was Willie Nelson. Okay, I saw Willie Nelson on TV the other night. He couldn't find his chair. I mean, the man physically is in good shape, but I'm sorry, he's just out of it. I don't know if marijuana is the only reason, but certainly I don't know how many life's lessons you have to do to realize there's danger.
Yeah, and we're not, and personally our office isn't arguing the fact that there's not maybe medicinal benefits to marijuana components. But what we're arguing is legislators shouldn't be legislating this drug. It needs to be done clinically through the Federal Drug Administration. Clinical trials need to be done, and then allow it to be dispensed by and produced in a clean environment where we know what's in that medication, we know what the risks are, and a pharmacist can dispense it. Because right now what you have in a lot of the states that have approved it is you have just people who growers have set up distribution centers in a town. And you have no idea the quality or the efficacy of that drug, the quantity of the drug in there. So it's just a whole, it's really mystifying to me that it's gone this way, that we've gone outside of the FDA process.
You know what's wrong with that idea? It makes sense. Politicians don't make sense. They make votes for themselves. I'm sorry.
Well, that's my plea.
I'm sorry.
Thank you for allowing me to talk, because anytime I get the chance to talk about this, I can't stress how critical this issue is. And there are people out there that may need some of the components of this drug, and I don't argue that may have some benefits, but let's do it the right way.
Mark, you must see some, I mean, you're out there on patrol, you must see some examples of young people abusing these entry-level drugs.
Yes, we do. In the scope of things, one of the rises we've seen is under the DUI law, it's not just alcohol, it's medication. That they're abusing their medication, getting behind a wheel, and it's still a DUI just because they're not intoxicated with alcohol. It's another way of intoxication.
Another way to lose a life.
Yes.
So sad, so sad. Craig, You're still the smartest guy I know. I thank you so much.
Thank you, Dean,
Mark,
for the opportunity.
What a pleasure meeting you.
Pleasure meeting you.
You guys, I said it before, I'll say it again. You have my admiration and my respect. And
Thank you.
And
Appreciate
Judy, the job you're doing out there, I too am an obsessive personality, and I've realized that in my life that once I develop a habit, I can't just quit. I have to replace it with another habit. I learned that from my eating problem. And so you're facing that every day with these young people, and you're doing a terrific job.
Well, thank you.
You're a special person.
Thank you.
Unrecognized but loved.
Yeah, thank you.
How's that? Ladies and gentlemen, it's been a great show. Again, we're going to urge you, support. Keep your eyes open. Be part of the neighborhood watch. Be part of the neighborhoods that make it right and a safe place to live. You have a great time, a great day, and we'll see you later. Thank you.